At 11 minutes past 2 in the morning, a man in surgical scrubs walked into room 412 at Calvert Hill Medical Center in Baltimore, and everything about him was almost right. Almost. The stethoscope hung backward, the chest piece dangling down his spine. The soles of his shoes were hard, not the soft kind worn by people who work on a patient care floor. The scrubs he wore still carried the sharp creases from the first time they had been taken out of the package. In his right hand was an uncapped syringe, the needle pointing down, less than 8 inches from the three-way junction of the IV line. The man in the bed had no idea he was coming. Gideon Rourke, 34 years old, and for 14 years there wasn't a port contract in that city he didn't touch. Men spent more than a decade trying to get within arm's reach of him, and not one of them managed it. Tonight he lay there in a hospital gown, an IV in his arm, sedated, unarmed, completely alone. Every layer of protection had already been peeled away. The 2 federal agents on his door had been pulled up to the 6th floor by a call that never happened. The camera in room 412 had gone dark 6 minutes earlier, the timestamp frozen in the corner of the screen. Whoever built that night had accounted for every single thing except one person. The night shift nurse the whole floor called, behind her back. The girl who doesn't hear right, 28 years old, deaf in one ear, eating dinner alone in the break room, and in 16 months in that building, not one person had ever thought she was dangerous. Her name was Delaney Pruitt. He pulled the weapon from inside his coat, and she was already inside his reach. One strike to the inside of his wrist. His hand opened against his will. 9 seconds later, the man in surgical scrubs was face down on the floor and he couldn't get up. That was their first mistake. It was also their last. If this story reached you, please leave a like so we know we're on the right path. Share it with someone you think needs to hear it too. And don't forget to subscribe, so the next story can find its way to you. At 9 o'clock that evening, the intensive care unit on the 4th floor of Calvert Hill Medical Center settled into the night shift the same way it did every night. The ceiling lights dimmed by 1 level. The sound of cartwheels in the hallway grew less frequent, and Delaney Pruitt received the handoff at the nurse's station with an open notebook before her. She listened to everything without interrupting once, then asked about exactly 2 details the departing nurse had passed over too quickly. After that, she washed her hands and began her first round. In room 405, a 64-year-old woman was beginning her second day after surgery, and her blood pressure at 7 o'clock that evening had been recorded as 122/76. Laney wrapped the cuff around her arm, inflated it, read the numbers, and wrote them down. Then she remained beside the bed, waited 3 minutes, and took the reading a second time. She waited another 3 minutes, and took it a third time. The 3 readings weren't identical. They differed by several points, and she entered all 3 into the chart in the proper order, along with the time of each measurement. The woman asked whether something was wrong. Laney said no. That 1 number couldn't say very much, but 3 numbers could begin to tell them something. The woman nodded as though no one had ever explained it to her that way before, then closed her eyes. Laney pulled the blanket up to her chest, turned off the bedside lamp, and left. In room 409, she remained longer than an ordinary round required. The patient was a 51-year-old man receiving fluids through an electronic infusion pump, and the rate displayed on the screen was 106 milliliters per hour. She removed the printed physician's order from its clip and read it again. 100. She read it a second time, this time including the signature line and the time beneath it. It was still 100, a difference of 6 milliliters per hour, a number small enough that 9 people out of 10 would glance over it without noticing, and small enough that if it continued all night, it would no longer be small by morning. Laney stopped the pump, adjusted the rate to 100, restarted it, and waited a full 30 seconds to make certain the number on the screen didn't change again. Then she opened the chart and recorded the time she discovered the discrepancy, the number she had seen, the number in the physician's order, and the adjustment she had made. She signed her name. She didn't go into the staff room to tell anyone. She didn't send a message to the nurse, who had handed over the afternoon shift. She didn't add a single comment to the shift report. She closed the chart, returned it to the rack, and continued. Room 407 was near the middle of the hallway, and inside was an 81-year-old man who had been admitted 2 days earlier. When Laney pushed open the door, he was lying on his side with his eyes open and his face turned toward the doorway. She asked whether he could sleep. He said he could, then remained silent for several seconds before saying he couldn't. She pulled over a chair and sat down. He said the room was too dark, but he didn't dare press the call button because he knew there were fewer people working at night, and he couldn't reach the light, and if he called someone over something like that, they would think he was being difficult. Laney didn't tell him he wasn't being difficult. She stood, went to the corner of the room, switched on the wall-mounted reading lamp, turned its shade toward the wall so that just enough light reflected into the room, then returned to the chair and sat down. She remained there for 4 minutes. The old man spoke about his grandchild who worked in Ohio, and about how he had never needed a light on to sleep in the past. Lainey listened, asked 2 questions, and didn't look at the clock once. When she stood, he asked whether she would turn off the light later. She said no, that it would remain exactly as it was until morning. He closed his eyes before she reached the door. In the hallway, she entered 2 lines in his chart, one about his sleep, and another about the light left on in the corner of the room and the reason for it. Then she returned to the nurse's station, took the next chart from the rack, and uncapped her pen. That was almost everything there was to the way Delaney Pruitt worked. She noticed. She documented. She returned to work. At 9:40, Lainey stood at the chart rack at the end of the nurse's station, running her fingers along the files as she searched for the chart from room 407 so she could add the line she had just written, when Dr. Corinne Ashford's voice carried from around the bend in the hallway. She was speaking to Dolores Pemberton, and she spoke in the voice of a woman who had never once in her life seen any reason to lower it. The head nurse wanted to assign Miss Pruitt to the special case that night, and Ashford had said no. "You have to tell that woman everything twice," she said. "Don't put her on a complicated case, and leave the whole unit writing incident reports until Christmas." Pemberton replied with something brief that Lainey couldn't hear clearly. Ashford didn't answer. She merely said she was going home, and the sound of her footsteps faded toward the elevators. Lainey didn't step out from where she stood. She didn't clear her throat, drop anything, or do anything else to let the 2 women know that someone was standing at the other end of the bend. She pulled the chart for room 407 from the rack, carried it back to the nurse's station, set it down, opened the shift log, and on the blank line beneath the time, she wrote 4 words in her small, even handwriting. Then she capped her pen and returned to work. 4 months earlier, Ashford had called her that girl in front of a patient and the patient's family. The second time she did it, Lainey recorded it in the log. Nothing happened afterward. At 9:55, the phone in her pocket vibrated. She looked at the screen, then stepped into the section of hallway beside the medication room, where fewer people passed, and answered. The caller was from the pediatric hospital's billing department, and the woman said very politely that Wyatt Pruitt's copayment for that month was 10 days overdue, that the amount was $1,900, and that her department needed to know when they could expect to receive it. Lainey said she would transfer the money before the 15th. The woman thanked her, then asked how Wyatt was doing that day. Lainey said he had eaten all of his dinner. She didn't add that it was the first meal he had finished in 4 days. She ended the call, stood there motionless for several seconds, then opened the hospital scheduling application, scrolled down to the following week, and accepted an additional 12-hour shift on Sunday. She slipped the phone back into her pocket and returned to the hallway. At 4:30 that afternoon, before beginning her shift, she had been at home. Their apartment was on the 3rd floor of a building in Highlandtown, and Wyatt had just been brought home by the center's van after his dialysis treatment. The 8-year-old boy lay on the sofa with a blanket over his legs, watching a cartoon he had seen no fewer than 20 times, and still laughing at exactly the same moments. Lainey sat beside him for 15 minutes and asked whether he had felt tired that day. He said not very tired. Then someone knocked on the door. She rose before the second knock could sound, went to the door, opened it only slightly, stepped into the shared hallway, and closed it behind her. The man standing outside was someone she had never seen before. It was a different man every month, and she had stopped trying to remember their faces a long time ago. She handed him the envelope she had counted out the night before. $900. The man took it, opened it, counted the money once with his thumb, nodded, slipped the envelope into the inside pocket of his coat, then turned and walked down the stairs. He didn't say a word. He didn't look at the door behind her. From beginning to end, the entire exchange lasted less than 40 seconds, and it was carried out as neatly as a transaction at a cashier's counter. Lainey remained in the hallway for another 10 seconds with her hand still resting on the doorknob, until the footsteps below had faded completely. Then she opened the door and stepped inside. Wyatt asked, "Who was that, sis?" She said it was someone from the building, then went into the kitchen and poured him a glass of water, and by 6 o'clock, she was gathering her things for work. 3 years, 36 visits. She had never asked the name of a single one of them. At 10:15, Lainey was updating the medication orders for room 406 when Dolores Pemberton walked directly toward her from the far end of the hallway. She didn't stop at the nurse's station. She took hold of Lainey's sleeve and pulled her into the alcove beside the medication cabinet, the place anyone who had worked on that floor long enough knew was where people discussed things that couldn't be discussed at the nurses' station. There was a transfer coming in, Pemberton said, lowering her voice. The ambulance was already on its way. The patient would go directly into room 412. Lainey took out her pen. She asked where the patient was being transferred from. Pemberton looked toward the end of the hallway before answering. That was the first problem, she said. They hadn't disclosed it. Lainey asked who the attending physician would be on their end. Dr. Ashford, Pemberton said. She had already gone home. Any clinical decisions were to be taken directly to her. Then she paused for a moment and added, "And I know what you're thinking. In 16 months, she hasn't answered her phone once after midnight." Lainey said nothing about that. She asked her third question. Was there anything else? Yes, Pemberton said. 2 federal agents would remain in the lobby all night, and no one except the treatment team was permitted to enter that room. Lainey wrote 2 lines on her left palm, a habit left over from the years when she had been required to remember everything, but couldn't always carry a notebook. And there was a fourth thing, Pemberton said, lowering her voice another level. Lainey looked up. The name on the chart, Pemberton said. It was false. At 10:40, the ambulance arrived at the exact time they had been given. Not 1 minute early, and not 1 minute late. And Lainey was already waiting at the elevator doors when the stretcher emerged. The accompanying nurse was a middle-aged man who looked as though he had been tired for many hours, and he handed her a thick file and began his report in the hallway instead of waiting until they reached the room. The patient's name was Peter Vaughn, he read. Male, 3rd day after surgery. Penetrating wound to the left abdomen with injury to the spleen. Emergency splenectomy performed Saturday night at another facility. 1 drain remained in the splenic bed, with approximately 40 milliliters of clear output during the previous 24 hours, and no evidence of further bleeding. There was also a soft tissue wound to the right thigh, sutured closed, with no complications. Prophylactic antibiotics were running. The patient was being maintained under light sedation according to physician's orders. He wasn't intubated. The tube had been removed the previous morning, and he was now breathing independently with oxygen through a nasal cannula, Lainey wrote. She wrote while he spoke without looking up once, and when he stopped, she asked 3 questions. The first was why the patient had been transferred. The nurse looked at her for 1 second, then said, "For security reasons," in the voice of someone who had been instructed to say those exact 3 words and nothing more. Her second question was whether anyone on the receiving end had signed the file. He said no. They had told him that handing the patient over to the nurse on duty would be sufficient. Her third question was whether the patient had received the required vaccination after his splenectomy. He turned several pages back, searched for a while, then said no, that the other facility had intended to administer it before discharge. Lainey wrote that down and underlined it once. The stretcher passed the nurse's station, turned left, and entered room 412. The 2 men in plain clothes remained in the ground floor lobby the entire time and didn't come upstairs. Lainey saw them on the security monitor when she returned to the station for more paper, both seated in chairs beside the reception desk, one holding a phone, the other holding nothing. She set down the file, opened it, and began reading again from the first page, much more slowly than she had written in the hallway. On the cover page, in the name field, 2 words appeared in the default typeface of some medical record system, Peter Vaughn, and beneath them were a date of birth, a medical record number, and a blank line where the name of the transferring facility should have been. At 10:52, Lainey closed the file, carried it with her, and entered room 412. She followed the same sequence she used with every new patient, moving through no part of it faster or slower than usual. She checked his airway. She counted his respirations for a full minute, instead of counting for 15 seconds, and multiplying by 4. She placed her stethoscope at the base of each lung and listened to both sides. She wrapped the blood pressure cuff around his arm, inflated it, read the numbers, removed it, waited, then repeated the process, waited again, and performed it a 3rd time, and she recorded all 3 readings in the chart with the time of each measurement. She lifted the edge of the gauze just far enough to inspect the surgical incision, examined the site of the drain, measured the fluid in the collection reservoir, and documented the amount. She checked the dorsalis pedis pulse in both feet. She examined his pupillary reflexes. She assessed his level of sedation and recorded the score. When she inspected the sutured wound on his right thigh, she paused for half a beat. The line of stitches was even, each one spaced the same distance from the next, the 2 edges of skin drawn together closely and symmetrically, with no stitch pulled tighter than another. It was the work of someone who had been given time and hadn't been hurried, and it was far neater than what an ordinary emergency case would have received on a Saturday night. Lainey replaced the gauze exactly as it had been and documented the condition of the wound without adding another word. Then she did the thing she always did last, the thing that appeared in no hospital procedure and on none of the checklists she had ever been given. She lifted the patient's hand to check his capillary refill. She pressed gently against the tip of one finger, counted, and watched the color return within the normal interval. Then she held his hand for several seconds longer than necessary. On the back of his right hand, near the base of the index and middle fingers, the bones rose in an unnatural ridge, the kind left by two metacarpal bones that had once been broken and allowed to heal without being set back into their proper positions, leaving a hard mass of bone protruding beneath the skin. The two knuckles in that same area were covered by thick calluses, darker than the surrounding skin, hardened and dry, the kind of thickness that formed only after many years. Lainey gently turned his left forearm to examine the intravenous site. Along the inner forearm, running diagonally downward from beneath the elbow, was a scar about 3.5 inches long. Its edges were sharp and even from one end to the other, without raggedness or contraction. And along the scar she could still see the marks left by stitches placed at regular intervals, the work of someone who knew how to suture. When she pulled down the collar of his gown slightly to check the monitor electrode on his chest, she saw a patch of skin on his right shoulder that was paler than the area around it, about the size of her palm, with indistinct borders and a faintly mottled surface of the kind left behind after repeated radiation treatments. Lainey returned the collar to its original position. She checked the nasal cannula and adjusted one side of the tubing so it wouldn't press against the rim of his ear. She looked at the monitor and read the 4 numbers displayed there once more. Then she lowered his hand and placed it in the exact position where it had been when she entered, resting palm upward on the sheet. The fingers curved naturally. She pulled the edge of the blanket up to his chest. She remained there for one more moment, watching his chest rise and fall with the slow rhythm of sedation, then picked up the file and left. She closed the door behind her gently, keeping her whole hand against it, instead of allowing it to shut on its own. Lainey returned to the nurse's station, set down the chart, opened it to the admission nursing assessment, and began to write. She used precise terminology and exact anatomical locations, and she didn't write a single word of speculation. Old deformity with bony callus involving the right second and third metacarpals. Chronic callousing over the metacarpophalangeal joints of both hands. Old surgical scar along the inner left forearm, 9 centimeters in length. She added the area of hypopigmentation on the right shoulder, recorded its size and borders, and stopped there. She entered the time, signed her name, closed the chart, and returned it to the rack. She didn't tell Pemberton. She didn't tell anyone. Not because she was hesitant, but because there was nothing she could say that wouldn't be speculation. And Delaney Pruitt didn't speak about things she couldn't first write as a line in a medical chart. At 12:20, Pemberton stopped at the nurse's station as she passed and asked how the special case was doing. Lainey gave her report. Blood pressure was 94/58, with all 3 readings equally low. The drainage remained clear and hadn't increased in volume. She had increased the intravenous fluid rate and was monitoring the trend. Pemberton wrote it in her small notebook, then hesitated. "Doctor, Ashford will say you should have called her," she said. Lainey knew that. She had known before Pemberton even approached the station. "I'll call when there's a reason," she said. "Right now I'm monitoring a trend." "A trend isn't an event." Pemberton nodded slowly, and Lainey watched her consider whether to say anything more, then decide against it. "Call me if anything changes," she said, then walked away. At 12:35, Lainey picked up the internal telephone and called the security desk in the lobby. She asked whether the 2 men in plain clothes were still there. The officer on duty said they were, 2 men seated beside the reception desk. She thanked him, replaced the receiver, and wrote in the shift log in her small, even handwriting, 12:35. 2 individuals confirmed, present. At 1:15, she called a second time and received the same answer. Still here, 2 individuals, present. She thanked him again and entered a second line in the log. Then she pulled her chair closer to the monitor in the corner of the nurse's station and opened the hospital's internal camera software. It was the kind of software hospitals purchased about 10 years earlier and never upgraded, with an interface so slow that she had to click 3 times before it would change the video feed. But it worked. She opened each camera feed on the 4th floor, in a fixed order she had never changed. The east hallway first, then the west hallway, then the southern stairwell door, then the alcove beside the medication cabinet, then the door of each patient room, one after another from one end of the floor to the other. She did this once every hour of every shift, and she had done so since her second week at Calvert Hill. It wasn't part of her job description. It wasn't included in any unit procedure. No one had ever asked why she did it, and she had never told anyone that she did. At the place where she had worked before, they called it a perimeter check, and she had never been able to stop. She closed the software, entered the time in the log, and turned to prepare the morning medication orders for the entire floor. At 1:50, she opened it again. Everything was normal. She closed it, recorded the time, and continued working. She watched. She documented. She returned to work. At exactly 2 o'clock, Lainey went up to the 6th floor to retrieve 2 syringe pumps that the endocrinology unit had borrowed from the 4th floor that afternoon and hadn't returned. She took the stairs. She walked the entire length of the 6th floor hallway from one end to the other. 3 patients were still awake, 2 watching television, and 1 sitting against a stack of pillows reading something. A nurse sat at the station writing notes, looked up to greet her, then lowered her head and continued writing. Lainey found 1 syringe pump in the procedure room and the other in the supply room, 2 separate rooms with 4 doors between them. No one was raising their voice. No one was standing close to anyone else. She carried both pumps back down by the stairs. At 2:02, she returned to the 4th floor, placed the 2 pumps on the equipment rack, and bent over the loan log to sign them back into the unit's inventory. At 2:03, the security radio mounted beside the nurse's station crackled. It had been there throughout the shift, hissing softly with background static all night, and most of the time, no one paid attention to it. The security dispatcher's voice cut through the static, brief and urgent. 6th floor. Altercation in the endocrinology unit. Immediate assistance required. Lainey raised her head from the log. The tip of her pen still rested on the unfinished line. She looked at the radio. She didn't run. She cross-checked. She had been on the 6th floor 20 minutes earlier. She had walked the entire length of that hallway. 3 patients awake. 1 nurse sitting at the station writing notes. 2 syringe pumps in 2 separate rooms. Nothing on the 6th floor at 2 in the morning could have turned into an altercation within 20 minutes without her seeing some sign of it as she passed. She watched the radio for 1 more beat. It had gone silent. She picked up the internal telephone and called the security desk. It rang. She counted. 6 rings. No one answered. She replaced the receiver and called again. 4 rings. No one answered. She set it down and didn't call a 3rd time. She pulled the security monitor in the corner of the station toward her, opened the camera software, and checked every feed from the 4th floor in the exact order she followed each hour. East hallway, normal, the timestamp in the corner advancing steadily. West hallway, normal, the timestamp advancing steadily. Southern stairwell door, normal. Alcove beside the medication cabinet, normal. Door to room, 405, normal. 407, normal. 409, normal. Then she switched to room 412, and she stood. She didn't run. She went around the back of the nurse's station and turned through the door leading into the service corridor, the narrow passage that ran parallel to the patient rooms, where the staff pushed linen carts and waste carts, a passage that didn't appear on any map posted for patients' families. She passed the linen room, the waste cart area, and the door leading to instrument processing. The soles of her shoes made no sound against the vinyl floor. She wasn't creeping. She merely moved like someone who had spent years learning how to travel, without announcing to anyone that she was moving, placing each foot from heel to toe, and never shifting her full weight to either side. She emerged at the western end of the floor, the entire length of the hallway away from the nurse's station. She stopped at the corner and looked down the corridor. It was empty. The ceiling lights had been lowered to night mode since 11 o'clock. The door to room 409 was closed. The door to room 407 stood slightly open. The southern stairwell door was closed. At the far end, the door to room 412 was shut tight. She moved along the right wall, where shadows from the door frames fell across the floor, keeping the same pace and never quickening. She stopped 2 steps from the door. She didn't stand in front of it. She positioned herself to the right of the frame, pressed close against the wall, an old stance that had been placed into her body long ago and had never been removed. She looked down at the narrow opening between the bottom of the door and the floor. Light shone from inside, the light from the wall-mounted observation lamp that was never turned off, spilling into the hallway in a pale yellow strip that stretched across the full width of the doorway. She watched that strip of light. It ran unbroken from one side to the other. Then, near the center, one section darkened. The dark section moved about 8 inches to the left, stopped, then moved again. "You're not part of this patient's care team," Lainey said. Her voice was flat, neither loud nor sharp, merely stating a fact. The man tilted his head. His eyes traveled from the top of her body to the bottom in less than 2 seconds. The look of someone making a rapid calculation and already certain of the answer. "Go back to the nurse's station," he said. "I'll be finished in a few minutes." He spoke with the voice of a man accustomed to giving orders to those beneath him in a hierarchy he'd never once thought to question. Lainey looked toward the bed. The man in the hospital gown lay exactly as he had when she'd left the room, his chest rising and falling with the slow rhythm of sedation. One calloused hand resting palm up on the sheet, the bones standing out beneath the skin. While the IV continued to drip steadily into his arm, she looked back at the intruder. "No," she said. What happened next wasn't a decision. Not one part of it was considered. It was the result of 10 years of repetition, repeated so many times that her body had learned to move before thought could catch up. And when it was over, the only sounds left in the room were the monitor and the man's breath forcing its way through clenched teeth. Lainey reached toward the foot of the bed, picked up the syringe that had rolled close to the leg of the table, set it upright on the bedside table with the needle pointing upward, then slid it to the farthest edge, where no one could accidentally brush it with a hand. He tried to shift his weight. "Don't," she said. He stopped. She held her position, her weight still pressing forward, without moving even slightly, and although her breathing was a little faster than usual, it remained steady. About 3 feet away, the man in the bed remained completely unaware of everything happening around him. The IV continued to drip. His chest continued to rise and fall at the same rhythm as before. The 4 numbers on the monitor remained within the ranges she'd entered into his chart at 11 o'clock. From the hallway came the sound of running footsteps, several people, still about 30 feet away. She lifted her head, looked toward the door, and waited. The door slammed against the wall. 2 hospital security guards entered first, and both stopped short at the threshold. Behind them stood Dolores Pemberton, and behind Pemberton were 2 plainclothes officers who had just come up in the elevator, their weapons already drawn and federal badges hanging from cords around their necks. All 4 looked down at the floor. The man in surgical scrubs lay face down, a nurse pressing one knee against his shoulder blade, while a gun fitted with a suppressor lay on the vinyl floor a short distance from the foot of the bed. The lead agent was a woman around 40 with close-cropped hair, and she opened her mouth to say the words people always said in situations like this. Lainey spoke first. "Don't let anyone touch the syringe before it's tested," she said. "It's on the bedside table. I set it upright." Then she continued, "And the camera in this room has been cut. You should find where it was disconnected." Her voice was no louder than when she read the shift report at the nurse's station. The short-haired agent studied her for exactly 1 more second, 1 second longer than necessary, then turned to the person beside her and told him to get the handcuffs. The second agent put on gloves, photographed the syringe exactly where it stood, before placing it in an evidence bag and sealing it, then did the same with the gun. One of the security guards was sent to get a flashlight and headed toward the service corridor, when the 2 agents pulled the man in surgical scrubs to his feet and propped him against the wall. His right arm hung at an angle no arm should ever hang. He didn't cry out. He didn't look at Lainey. He stared at a fixed point on the opposite wall, his face completely empty. The hallway outside began to fill with people. 2 more agents arrived. Pemberton had called down to the operations room and was speaking into the phone in a voice no one on that floor had ever heard her use before. Brief, clipped, without a single wasted word. Then the door to the south stairwell flew open, and Dr. Corinne Ashford stepped out. She was still wearing the clothes from the day before, her identification lanyard twisted once around her neck, and she was breathing hard because she'd been moving faster than she normally did. She stopped 3 times. The first time was when she saw Lainey standing in the middle of the room. The second was when she saw 4 federal badges. The third was when she saw the man sitting against the wall with one arm hanging crookedly at his side. "What's going on here?" Ashford said, and she said it loudly. "Who authorized this?" The short-haired agent walked past her and out through the door without breaking stride. "Your nurse did," she said. Ashford turned toward Lainey. Her mouth opened. Lainey had already turned her back. She walked to the head of the bed, removed the chart from its holder, and uncapped her pen. She checked the 3-way stopcock on the IV line and confirmed that it hadn't been tampered with. She traced the tubing from the needle to the fluid bag and checked the drip rate. She looked at the monitor and read all 4 numbers. She bent down, estimated the amount of fluid in the drainage container, and compared it with the figure she'd recorded before midnight. Then she wrote, 2:14 in the morning, an individual not affiliated with the treatment team was found in the patient's room, restrained, and transferred into federal custody. 2:16 in the morning, IV line inspected, intact. No evidence that any additional substance was introduced into the system. Blood pressure 98/61. Pulse 72. Respiratory rate 14. No increase in drainage output. Patient remains at the prescribed level of sedation, unchanged. She recorded the time. She signed her name. She closed the chart and returned it to the holder. Then she pulled the blanket up to the man's chest, exactly as it had been when she'd last left the room. Behind her, in the hallway, Ashford was speaking to Pemberton in a low, strained voice. Lainey caught 2 words. Overstepped authority. She didn't turn around. A man in his 50s entered and stopped at the threshold. He wore plain clothes. He hadn't drawn his weapon. He held his badge in his hand instead of wearing it around his neck. He looked at the place where the gun had just been lifted from the floor. He looked at the bedside table where the syringe had stood. He looked at the man sitting against the wall with one arm hanging crookedly at his side. Finally, he looked at Lainey. He didn't ask what had happened, because he'd already seen enough to know he didn't need to. "What's your name?" he said. "Delaney Pruitt." He nodded slowly. He folded his badge shut and slipped it into the inside pocket of his coat. "Pruitt," he said. "Are you related to Errol Pruitt in Highlandtown?" Lainey went completely still. At 3:10 in the morning, they sat down in the small consultation room across from the nurse's station, the room with 2 worn armchairs that the floor still used when speaking with families after nights that hadn't gone well. The man in his 50s introduced himself as Hollis Barrow, head of the Organized Crime Task Force, and said that from that moment forward, everything concerning Room 412 would go through him. The woman in the dark suit seated beside him was Bethany Wolcott, a federal prosecutor. Pemberton stood leaning against the door. Lainey sat down, still holding the pen in her hand, and recounted everything in exact order. The radio call at 2:03, the fact that she'd walked the full length of the 6th floor 20 minutes earlier, and what she'd seen there, the 2 unanswered calls to the security desk, and what she'd discovered when she checked the cameras. She left out no detail and added none. And she didn't use a single word she couldn't prove. She also told them that she checked the camera on the 4th floor once every hour. Wolcott looked up from her tablet. "Is that part of your assigned duties?" she asked. "No," Lainey said. Wolcott wrote down one line. Barrow waited until Wolcott had finished her questions before speaking. He warned Lainey that he was about to share certain information with her, and once she heard it, she couldn't return to not knowing. Lainey set down her pen. "The man in room 412 isn't named Peter Vaughn," Barrow said. "His name is Gideon Rourke." The name fell into the center of the small room, and Pemberton, still leaning against the door, shifted her weight to the other foot. "6 days ago, he contacted us voluntarily," Barrow continued. "Not through an attorney, and not through an intermediary. He called the office number directly and requested a meeting. We met with him twice. At the second meeting, he said he was prepared to sit down and give a full statement, and he asked for 3 days to put a few matters in order. Those 3 days ended 3 days ago," Wolcott said. "His car was intercepted on the Beltway shortly before 10 o'clock at night, near the northbound exit. 2 vehicles boxed him in from the front and the rear. The entire thing was over in less than 40 seconds. His driver was named Anthony Cavelli. He'd worked for him for 9 years, and he died at the scene. Mr. Rourke was struck by 1 bullet in the left side of his abdomen and another in his right thigh. And the only reason he's still alive is that Cavelli had already steered into the median, forcing the other 2 vehicles out of position. The first hospital operated on him that same night." Lainey listened to all of it. When Wolcott stopped, she said only one thing. "Then I need to give him the pneumococcal, meningococcal, and Hib vaccines before he leaves this unit," she said. "A patient without a spleen loses the ability to fight off a particular group of bacteria, and the other hospital didn't administer them." Wolcott watched her for a moment. Barrow didn't look at her. He looked through the window toward the hallway. Then he said what he'd been waiting to say. "What happened tonight wasn't a drug thief wandering into the wrong room," he said. "The man we arrested was hired. He knew which room to enter. He knew the patient was being transferred here tonight. He knew enough to stage a call that drew my people away at exactly the right moment. And he knew where to cut the signal to one specific camera. Information like that doesn't simply appear." He turned back to look at her. "That means there'll be a second attempt," he said. "It may happen tonight, or it may happen next week, but it'll happen. And the person who ordered the first attempt now knows there's a nurse on the 4th floor of Calvert Hill who ruined their plan." He let those words rest in the room for several seconds. "You have the right to step away," he said. "I can request a change in your assignment immediately. No one will ask why, and nothing will be entered into your personnel file. You can go home, and this won't be your concern anymore." Pemberton started to say something, then stopped. Lainey looked down at the notebook in her lap. She thought of the elderly man in room 407 and the reading lamp that would remain on in the corner of his room until morning. She thought of the 12-hour Sunday shift she'd have to give up. Then she thought of the calloused hand with the bone that had healed crookedly, the hand she'd placed back in its original position 4 hours earlier. "I'm working my shift," she said. Barrow nodded once, and didn't try to persuade her in either direction. He only said, "All right." At 4 o'clock in the morning, the technical team found the place where the signal cable had been disconnected. It was inside a junction box above the service corridor's suspended ceiling, about 23 feet from the door to room 412. At 5:30, Laney entered the room to check his blood pressure again. She was removing the cuff from his arm when the hand lying palm up on the sheet slowly closed, the fingers curling inward about half an inch, then opened again. She didn't call anyone. She set the cuff down, recorded the reading in the chart, then stood at the foot of the bed and waited. The hand closed a second time, and this time it remained closed longer. His eyelids fluttered, then they opened slightly and stopped there. He didn't search for a face first. He looked at the ceiling for one beat. Then his eyes traveled from left to right along the opposite wall, pausing at the door, at the narrow gap beside the curtained window, at the monitor mounted on the wall, and at the empty chair in the corner before finally lowering to where she stood. The entire sequence took less than 3 seconds, and no part of it was accidental. Laney had watched many people wake from sedation. Most began by searching for a face. This man began by searching for exits and places where someone might be standing. He tried to lift his head from the pillow. "Don't," she said. He stopped. She walked around to the head of the bed, poured water into a paper cup, inserted a straw, and held it to his mouth at an angle that didn't require him to raise his neck. "Small sips," she said. He took 3 sips, then turned his face away from the straw. "Who are you?" he said. His voice was hoarse and ragged, the lingering effect of an endotracheal tube removed less than 2 days earlier. "Your nurse," she said. He looked at her. She picked up the chart and told him exactly what she told every patient who had just regained consciousness. "You're at Calvert Hill Medical Center, on the 4th floor, in room 412. You arrived here last night at 10:40. Your spleen was removed 3 days ago at another facility, and you currently have a drain in the splenic fossa and a sutured wound in your right thigh. One of your ribs is bruised, not broken, so taking a deep breath will hurt. Your throat will remain sore for approximately 4 to 5 days. You mustn't attempt to sit up during the next 24 hours, and you absolutely mustn't pull on the tube in your abdomen, no matter how uncomfortable it becomes." He listened to all of it. He didn't ask the questions people usually asked. "What happened last night?" he said. Laney set the chart down on the edge of the table. "A nurse was on duty," she said. "The only sounds left in the room were the monitor and the oxygen flowing through the nasal cannula." He looked at her. He looked longer than someone newly awakened should look at another person, longer than courtesy allowed, and he made no attempt to hide the fact that he was studying her. His gaze dropped to the name badge on her chest, then to her 2 hands resting on the bed rail. It remained there for a moment before returning to her face. Laney let him look. She'd stood that way before many people in many places, and she'd learned long ago that turning away always revealed more than remaining still. He planted his left elbow against the mattress and began pushing himself upward. She placed her right palm against the center of his sternum and pressed down. Not hard, not quickly. Her hand was positioned precisely, her wrist locked, her elbow steady, and all the force came from her shoulder rather than her arm, just enough to stop the movement without pressing on the incision, and not a fraction more. He pushed for another half beat and couldn't rise. Then he stopped, not because of the pain. She saw the exact moment he stopped, and it wasn't the moment of a man halted by pain. It was the moment of a man realizing that the force holding him down had been applied by someone who knew exactly what she was doing. His eyes moved down to the hand resting on his chest, then rose to her face. Laney withdrew her hand. She straightened the edge of the blanket. She checked the IV site, measured the drainage, and adjusted the nasal cannula. He lay still while she worked, his eyes following her the entire time. "Did anyone enter this room last night?" he said. He spoke more slowly than he had before. "Yes," she said. He waited. She said nothing more. In the hallway, one of the 2 agents shifted his weight, the sole of his shoe scraping softly against the floor. He heard it. She saw him hear it. She wrote in the chart, 5:34. Patient awake and responsive, oriented to time and place. No evidence of confusion following sedation. Surgical pain rated 4 out of 10. Patient attempted to reposition without assistance. Instructed to limit movement. She recorded the time. She signed her name. She was closing the chart when he spoke, and this time his voice was noticeably clearer, as though he'd gathered everything still left inside him and poured it into a single sentence. "Where did you train?" he said. Lainey returned the chart to its holder. She adjusted the IV flow rate. She dimmed the wall light by 1 level. Then she walked toward the door. She didn't turn around. She didn't answer. Barrow was standing in the alcove beside the medication cabinet when she came out of room 412. And he wasn't standing there to rest. He held a tablet and a cup of cold coffee, from which he hadn't taken a single sip. "He's awake," Lainey said. "He's oriented and responding well. Blood pressure is 102/64. If you need to take his statement, I recommend waiting at least 4 more hours because the sedative is still in his system, and he may remember the sequence of events incorrectly." Barrow nodded and made a note, but he didn't ask anything else about the patient. He turned the tablet screen toward her. "The man we arrested is named Pierce Holloway," he said. 43 years old. He wasn't carrying any genuine identification, but his fingerprints matched records held by 3 different agencies. He takes contract work. In the pocket of his lab coat, we found a prepaid phone activated 11 days ago, and it contained exactly 4 calls. The first 3 were all made to the same number in another state. That number is now out of service. The 4th call was different. He touched the screen. "This call was made at 8:13 last night and lasted 1 minute and 52 seconds. My technical team has finished cross-referencing the cell tower data and the internal network access point used by the device at the other end to determine its location." Barrow looked up. "It originated from inside this building," he said. "The 4th floor. Not the patient care area. The administrative section. West wing. At the end of the office corridor." Lainey said nothing. "That call was placed at 8:13, Barrow continued. "My people finalized the transfer schedule at 9 o'clock. That means the caller knew 47 minutes before we did." He set the tablet on top of the cabinet. "His identity wasn't what was sold," he said. "The other side had known that for a long time. What was sold was the schedule. What time the vehicle would leave, which entrance it would use, which floor he would be taken to, which room he would occupy, who would be working that shift, and how many of my people would be stationed where. That's the only information that could allow someone to walk straight into room 412 at 2 o'clock in the morning and know exactly how many minutes he had." He took a sip of the cold coffee, then set the cup down. "The list of people who knew that schedule before 9 o'clock is very short," he said. 4 people on my side, 3 at the hospital." Lainey looked down the corridor. At the far end, Pemberton was preparing to hand over the shift log to the day staff coming on duty. 2 agents stood on either side of the door to room 412. The floor had already been cleaned again. "At least 2 people in this building didn't go home last night," she said. "I'm not saying what that means. I'm only saying it doesn't rule anyone out." Barrow turned to look at her. "And if you lock down the 4th floor's west wing right now and call each person in for questioning," she said, "then within an hour, everyone in this building will know you're looking for someone on the inside. The person who sold the information will know before anyone else, because they're the only ones sitting there waiting to see whether you've found them. And they'll have an hour to erase everything and call whoever needs to be called." She paused for 1 beat. "They failed last night," she said. "But they don't know you've traced the call from 8:13. People handle a failed operation very differently from one they know has been exposed." Barrow didn't answer immediately. He studied her longer than necessary, in exactly the same way the man in room 412 had studied her 40 minutes earlier, and Lainey realized that both men were doing the same thing, trying to place her into a category where she didn't fit. "That isn't a nurse's intuition," he said. "No," she said. "It isn't." Barrow picked up his coffee cup, then set it down again. He took out his radio and spoke into it in a low, concise voice, instructing the technical team to leave the 4th floor's west wing exactly as it was. Seal nothing, question no one, and quietly retrieve every access card record for entry into and exit from the administrative section during the previous 24 hours, without revealing that they were doing so. He put the radio away. "We'll leave it untouched," he said. He took 2 steps, then stopped. "Miss Pruitt," he said, "if that person works in this building, then they've just had a very long night, and this morning they'll want to see for themselves what happened on this floor. People can't bear sitting in the dark and waiting." He walked toward the elevator. At 5:47, the elevator doors at the end of the corridor opened, and a silver-haired man stepped out. Lainey recognized him. Roland Fitch, director of bed coordination and admissions, whose office was in the 4th floor's west wing. No one had called him. His name wasn't on the emergency contact list for that hour. He walked directly toward the nurse's station. Fitch stopped in front of the nurse's station. "Miss Pruitt," he said, "I just heard about what happened last night. I came down to see how everyone is doing. Something like that affects an entire shift, not just one person." "Thank you," Lainey said. Everyone is continuing to work as usual. Are you all right? Fitch asked. The hospital has a counseling program for employees. I can arrange a session for you today if you'd like. I'm fine, she said. I'll tell the head nurse if I need one. He nodded. He looked toward the far end of the corridor, where 2 agents stood on either side of the door to room 412. How is the person inside? He asked. I'm not permitted to discuss that patient's condition with anyone outside the treatment team, Laney said. He nodded again and said, Of course. Following procedure is always best. He asked 2 more questions about the day shift and the person who would receive the handoff, and Laney answered both with words polite enough to reveal nothing. He remained there for another moment, his eyes moving slowly from one end of the corridor to the other, lingering on the door to room 412 longer than anywhere else. Then he wished her a smooth end to her shift and turned away. After taking 3 steps, he called back. Oh, if the next shift asks, just tell them the ambulance arrived at 10:40. That'll keep the paperwork consistent. Laney was still holding the shift log in her hand. Her expression didn't change. She waited until the elevator doors closed. 2 facts, placed beside each other, without inference. First, it had rained from 8 o'clock the previous night until 4 o'clock that morning. The employee parking lot was roughly 700 feet from the entrance, and his shoes were dry. Second, the ambulance's arrival time wasn't on the assignment board hanging in the corridor, wasn't in the admissions system, and didn't appear in any document received by the bed coordination office. It existed only in the minds of 7 people, and in the federal record. She closed the log, walked into the alcove beside the medication cabinet, and sent Barrow a 3-line message. He came upstairs within 4 minutes. She repeated those 2 facts to him in the same order and added nothing. Barrow listened to everything without asking a single question. I'm not drawing any conclusions, she said. I only thought you should know. Then she returned to the nurse's station and continued writing the handoff report. Barrow took out his radio and spoke 4 words into it. At 6:20, Roland Fitch was invited into the small consultation room across from the nurse's station. No one put him in handcuffs. No one stood blocking the door. Wolcott told him that he wasn't under arrest and had the right to call an attorney at any time. He sat down in the old armchair in the corner. He didn't object. He didn't ask why. He asked only one question, whether this would be posted on the hospital's internal bulletin board. And when no one answered, he nodded as though he'd already known. Barrow placed before him the access card records from the previous 24 hours, and a single printed page bearing the time 8:13. Fitch stared at that page for 20 seconds. Then he began to talk, and he spoke continuously for 40 minutes without stopping. His son, 26 years old, owed the Sarkeesian family $320,000. 14 months earlier, someone had approached Fitch in the employee parking lot and offered him another way to repay it. They didn't need money. They needed schedules. Transfer schedules, admissions under false names, surgeries requiring security, who was staying in which room, and at what time. He said he'd told himself they were only lines on a spreadsheet. He said that by the 6th month, he'd understood exactly what he was selling, and he said that by then, stopping had become more dangerous than continuing. At 7 o'clock, Barrow left the consultation room and walked to the nurse's station, where Laney was completing the handoff for the day shift. He didn't sit down. You were right, he said quietly. At 7:10, the day shift arrived. Marguerite Sable stepped out of the elevator, stopped for 3 seconds when she saw the 2 agents standing outside room 412, then walked directly to the nurse's station and said, All right, tell me everything. Laney gave her report for 22 minutes. She went through every room, every number, and every change in the physician's orders. When she reached room 412, she reported the clinical information first, and everything else afterward. The patient has been awake since 5:34. His blood pressure is gradually rising. Maintain the current fluid rate for another 4 hours, then reassess. Drainage output is 45 milliliters over 24 hours. It remains clear and hasn't increased. He'll try to sit up, she said, and he'll do it when you leave the room. His vaccines following the splenectomy still haven't been administered. I've added them to the task list. Don't let them get pushed to tomorrow. Sable wrote down every line and asked no questions except those concerning his clinical care, and that was why Laney always felt a sense of relief whenever she handed a shift over to her. At 7:35, Laney retrieved her purse from her locker and walked into the stretch of corridor near the stairwell. Ashford was standing there. She was still wearing the clothes from the day before. No one else was in that section of the hallway. She didn't block Laney's path. She simply stood there, and when Laney came closer, she called her name. Laney stopped. I owe you an apology, Ashford said. She waited. Ashford looked down at the floor, then raised her eyes. "Last month, I nominated you for the unit's Patient Safety Award," she said. "Then I withdrew the nomination." "You didn't know because I withdrew it before the committee had a chance to meet." Lainey said nothing. "I withdrew it because I thought your documentation was too rigid," she said. "Those were the exact words I wrote in my letter to the committee. Too rigid. I thought you documented everything, because you couldn't distinguish between what mattered and what didn't." She paused for one beat. "That's what I thought," she said. "And for 16 months, I never questioned myself once. Last night, I sat in the break room and reread every line you wrote about this case." She left the sentence unfinished. She didn't say the rest. "I'm not asking you to forgive me," she said. "I only thought you should hear this from me instead of someone else." Lainey looked at her. Ashford wasn't a bad person, and Lainey had never believed she was. She was a different kind of person. Someone who had been good at her job for so long that she'd lost the habit of asking whether she might be wrong, and people like that rarely changed, until the cost of refusing to change became too obvious to look away from. "I know," Lainey said. Ashford nodded once, then walked past her toward the stairwell. At 7:50, Lainey still hadn't left. The patient in room 409 had suffered a drop in blood pressure, and Sable was occupied there. Lainey said she would handle the 8 o'clock antibiotics for room 412, and Sable nodded without looking up. The morning medication cart had been pushed against the wall since 7 o'clock. The antibiotic bag for room 412 was in the middle drawer, with the printed order clipped to the outside. Lainey removed it and began the procedure she'd performed several thousand times. Read the patient's name on the label. Read the medical record number. Read the name of the medication, its concentration, volume, route of administration, and infusion rate. Compare it with the printed order. Compare it with the patient's wristband. Then came the final step, recording the lot number and expiration date in the unit's medication log. She opened the log to write. The lot number on the label contained 7 characters, 2 letters followed by 5 digits. In the log, all 5 bags of the same medication received that week began with 2 different letters. She turned back 2 pages. During the previous 3 weeks, no lot had carried the same prefix as the bag in her hand. She placed the bag on top of the medication cart and examined the label carefully. The hospital pharmacy used a standard typeface, and on the line naming the active ingredient, the strokes of the letters on this label were slightly thinner and missing a small curve, something she'd seen every day for 16 months, but had never before had a reason to examine closely. She turned the bag over. On the back, beside the medication port, was a small tamper seal applied by the pharmacy after preparation. The seal on this bag was perfectly flat. There wasn't a single crease along the edge, a single misalignment, or one trapped air bubble. Lainey had applied and removed thousands of seals like it, and she knew what a seal applied during a busy shift looked like. It never looked like this. Holding the medication bag by one upper corner between 2 fingers, she entered room 412. The man in the bed looked at her. She didn't look at him. She placed the bag on the bedside table, walked to the IV pole, and checked the bag currently infusing. Its lot number matched the log. She looked at the pump display. The current bag had 40 seconds remaining, and according to procedure, it would be replaced with the new bag when it emptied. Lainey clamped the IV line. She rolled the clamp all the way down, stopped the pump, and disconnected the tubing completely from the 3-way stopcock. "What's wrong?" the man in the bed asked. She didn't answer. She went to the door and said to the agent standing on the left, "Call Barrow up here immediately, and tell him no one is to leave this floor." The agent studied her face for exactly 1 second, then reached for his radio. At 8:05, Barrow came upstairs. Lainey pointed to the medication bag on the bedside table and gave him 3 sentences. "The lot number isn't in the unit's medication receipt log. The typeface on the label isn't the one used by the hospital pharmacy. The tamper seal on the medication port was removed and reapplied by someone who had enough time to make it perfectly flat." Barrow didn't ask whether she was certain. He called the technical team. The medication bag was placed in an evidence bag and sealed at 9:27, then removed from the building at 9:40. At 1 o'clock in the afternoon, the results came back, and Wolcott read them in the consultation room in the voice of someone struggling to keep it calm. She set the page down and needed 1 beat before continuing. "That bag contained the medication listed on the label," she said. "It also contained 2 substances that weren't prescribed. If the entire bag had infused, he would have died in his sleep in the middle of an ordinary morning, with a medication bag hanging from the IV pole and a valid order in his chart." She looked at Lainey. "And in the medical record, it would have looked like a complication," she said. "No one would have asked a single question." Barrow opened the pharmacy delivery log in front of them. The fourth floor's morning medication cart had been delivered at 7:12, and the person who signed for it was a transport worker named Casey Bidwell, 22 years old, who had started 3 weeks earlier under a temporary contract through a staffing agency. Barrow read the name of the company, then handed the tablet to Wolcott. The company was registered in Delaware, had no other employees, and listed a mailbox in Wilmington as its headquarters. At 8:20, Barrow asked security to retrieve Casey Bidwell's access card history for the previous 6 hours. At 8:32, Human Resources confirmed the 3-week temporary contract and the name of the staffing agency. At 8:41, the answer came back. Bidwell's card had been used at the employee entrance at 6:51 that morning, and it hadn't been used to exit through any door. "He hasn't left the building," Barrow said. He didn't raise his voice. He took out his radio and delivered a short series of commands. And within 90 seconds, at 8:45, Calvert Hill Medical Center was locked down from the inside. There was no announcement over the speakers. No alarm sounded. The exits were secured one by one. Teams moved into position at all 4 stairwells, and every department head received a private call. Wolcott said the patient had to be moved out of room 412 immediately. Barrow said the last room in the second floor's east wing had been cleared that morning in case it was needed. "Don't use the elevator," he said. "It can be stopped between floors, and today I don't want anyone trapped inside a steel box." Lainey was already inside the room before he finished speaking. She lowered the head of the bed, removed the monitor electrodes from Rourke's chest, took off the blood pressure cuff, and left the IV line and nasal cannula in place. She removed the fluid bag from the pole, coiled the tubing with just enough slack, and hung it from a hook on the equipment cart. She checked the drainage container, then clipped it to his hospital gown so it would remain below the end of the tube. "We're going down to the second floor by the stairs," she said. "You can walk, but you'll walk slowly, and I'll support you on the left. Don't hold your breath as you step down." He sat up without her help, and she allowed him to do it because she could see that he was using the correct method, pressing one hand into the mattress, turning his body, lowering both legs first, then sitting on the edge of the bed for 30 seconds to let his blood pressure catch up. One agent opened the stairwell door and walked 2 steps ahead. Another closed the door behind them and followed at the rear. Rourke was much heavier than he had seemed while lying in bed. By the 3rd step, Lainey had to redistribute his weight, sliding her left shoulder beneath his armpit instead of supporting him only around the waist, and lowering her hips slightly so the force traveled straight upward from her legs. She'd learned how to lift people when she was 18, and she'd never lifted anyone with her back. He descended 1 step at a time, placing his heel down first. Every time his right leg took his weight, the muscles on the left side of his abdomen tightened. Every time they tightened, his breath shortened for 1 beat. He didn't cry out. He didn't stop. He didn't speak a single word during the first 27 steps. At the landing between the 4th and 3rd floors, she made him stop for 30 seconds. He leaned against the wall, one hand gripping the railing, his head slightly lowered as he breathed through his nose in short, controlled rhythms. The breathing of a man who had learned somewhere how to endure pain without allowing it to occupy every space inside him. The fabric of his hospital pants began to darken over his right thigh. Lainey lifted the hem of his gown, pressed 2 fingers against the edge of the dressing, and determined that the wound was only seeping. She committed the time to memory. "You can leave me here," he said. "Call the other 2 down. I'll walk the rest of the way myself." "No," she said. He raised his head. It was the 2nd time she'd said that word to him since the previous night, and he knew it was the 2nd time. He pushed himself away from the wall and extended his arm so she could move beneath it. They descended the remaining 20 steps to the 3rd floor and all 27 steps to the 2nd, and by the time they reached the 2nd floor door, the back of his hospital gown was dark with sweat, and Lainey had been forced to change her support position once more because her left shoulder had begun to tire. The last room in the 2nd floor's east wing already contained a bed, an IV pole, a monitor, and a chair in the corner. She let him sit on the edge of the bed before helping him lie down. She rehung the fluid bag, opened the roller clamp, reset the infusion rate, reattached the electrodes, checked his blood pressure and pulse, changed the dressing on his thigh, measured the drainage, and recorded everything on a separate sheet of paper because his chart was still on the 4th floor. 94/59, pulse 96. He lay on his back staring at the ceiling, his breathing steady again. Lainey coiled her stethoscope and slipped it into her pocket. In the hallway, Barrow was speaking on the phone. When the call ended, he pushed open the door and entered. He didn't look at the patient first. He looked at Lainey, then at the patient, then decided to speak in front of them both. "We traced the payment made to Holloway," he said. It didn't come from anyone connected to the Sarkeesian family. It passed through 3 layers of intermediaries before being withdrawn from the account of a shipping company at the South Harbor. He looked at the man in the bed. That company belongs to you. Gideon didn't ask Barrow to repeat himself. He didn't say it was impossible. He lay still, staring at the ceiling for about 15 seconds, then said, "I need to sit up." Laney raised the head of the bed to 40 degrees. Barrow pulled the chair from the corner closer and sat down. "You want to know why I called you 6 days ago?" Gideon said. He was speaking to Barrow, but he looked straight ahead. In March of this year, there was a chain of 3 pharmacies on the north side, valid licenses, qualified pharmacists, doors opening on time like every other pharmacy. They were located in territory where my organization collected protection money. I knew they existed. I didn't know what was moving through them. He paused to draw breath. Medication had part of its active ingredient removed, was diluted, then repackaged in genuine packaging. Over 14 weeks, 9 people died. The youngest was 21. I banned that a long time ago. Banned. That's the word I used. And for 14 years, when I used that word, it meant something. He turned his head toward Barrow. I ordered those places closed in April. 3 weeks later, they reopened under a different name, at the same addresses, with the same people. I stopped collections across the entire district. The money kept coming in. It simply arrived through a route I couldn't see. I sent people to ask questions. 2 came back and said there was nothing there. I knew they were lying. And I knew why they were lying. They feared someone else more than they feared me. He paused longer than before. "I stand at the head of an organization I spent 14 years building," he said. "And I couldn't stop a network operating directly beneath my feet. That was when I understood it couldn't be stopped from the inside. So I called you." Laney stood at the foot of the bed with the vital signs sheet in her hand. She asked exactly one question. "Who created that network?" she asked. He didn't answer. He didn't turn toward her. Barrow didn't press him. Laney didn't ask again. The only sounds in the room were the monitor and someone pushing a cart through the second-floor hallway, and the silence lasted longer than 3 people in one room would ordinarily allow. Then Gideon asked Barrow, "How many people are authorized to sign on that shipping company's account?" "According to the records, 2, Barrow said. "I'm one of them," Gideon said. "Yes," Barrow said. "The other person can't withdraw more than $50,000 without a second signature," Gideon said, "unless they change the signature specimen on file at the bank. And to change it, they would need a notarized power of attorney from me." "We'll determine when the signature specimen was changed," Barrow said. "There's no need," Gideon said. "I need to borrow a phone." "Not mine," Barrow said. "Not yours," Gideon said. He turned toward Laney. Laney looked at Barrow. Barrow looked back at her and nodded once. And within that nod was a calculation that had been completed before it even began. "Put it on speaker," he said, "and record it." She handed her phone to the man in the bed. He entered a number from memory. 2 rings. An older man's voice answered with one short word. "Do you know I'm still alive?" Gideon said. Silence came from the other end. 3 seconds. And those 3 seconds were the longest of that entire morning. Then the man's voice spoke his name. Only his name. Nothing else. Gideon ended the call. He returned the phone to Laney, and his hand didn't tremble at all as he did it. Barrow had risen to his feet. He didn't ask who had answered. He waited. Gideon looked through the second-floor window, where part of the parking lot and a row of trees were visible. "Ambrose Teague," he said. He spoke the name in exactly the same voice he'd used when speaking about his incision and the 9 people who had died, neither higher nor lower. "My father died when I was 12, he said. "That night, Ambrose took me home with him. He raised me. He taught me everything I know about how an organization operates. During the past 22 years, I've suspected everyone else around me at least once." He didn't finish the second half. He didn't need to. Barrow went outside to make a call, leaving only 2 people in the room. Gideon turned toward her. "Who are you?" he said. It was the 3rd time he'd asked her some version of that question. But this time it was entirely different from the first 2. Slower and more direct, like a question the person asking had already decided he wouldn't take back. Laney closed the chart. "I enlisted when I was 18 because my family couldn't afford my mother's medical treatment," she said. "Combat medic. 2 deployments. A sergeant taught me hand-to-hand combat for 6 years because he said the medic was the only person in the vehicle who didn't carry a weapon. When I was 24, a roadside explosion damaged one of my ears, and I was medically discharged. I went to nursing school. That's all." He didn't ask about her ear. He didn't ask about the 2 deployments. He asked a different question. "What was your father's name?" he said. "Errol Pruitt," she said. The only sounds in the room were the monitor and a cart rolling through the hallway outside. Laney looked directly into his face when she spoke the name. so she saw it clearly. Nothing dramatic happened. He didn't flinch, change position, or look away from her. Something behind his face merely stopped for about 1 second, like a machine running steadily when its power was cut, and then restored. And when it began running again, it moved at a different speed. He remained silent for 7 seconds. Then he looked out the window. "You should get some rest," he said. At 1:40 in the afternoon, they found him. Not because of the cameras, since there were no cameras in the basement mechanical area, but because a maintenance worker reported that the door leading to the machinery corridor behind the laundry area had been wedged shut from the inside. 2 agents went down first, secured both ends, and called through the door 3 times without receiving an answer. The 4th time, they heard someone moving inside, and a voice called out, telling them not to come in. At 2 o'clock, Barrow went downstairs. "He has a weapon," the agent on duty reported. "He hasn't threatened anyone. He just keeps saying not to come in." Lainey stood about 16 feet away, leaning against the painted brick wall, still wearing the same nursing uniform she'd worn for 17 hours. "How long has he been in there?" she asked. Barrow looked at his watch. His card was used to enter at 6:51 this morning. "We locked down the building at 8:45. He couldn't have left after that." "Almost 7 hours," she said. She looked at the gray steel door set flush with the wall at the end of the corridor, the kind of door people walked past their entire lives without ever noticing. "Let me talk to him," she said. Barrow said no. "I won't go inside," she said. "I'll stand outside the door." He looked at her, then at the door. He knew what everyone standing in that corridor knew, that the only remaining option was to wait several more hours and then force the door open, and no one could control what would happen after that door was breached. "Stand to the side," he said. "Don't stand in front of it." "I know," she said. She walked forward, stopped 2 steps from the door, and pressed herself against the wall on its right side. She didn't knock. "My name is Delaney Pruitt," she said. "I'm a nurse on the 4th floor." No one answered. She didn't continue immediately. She waited a full 20 seconds. "Are you hurt?" she asked. The silence stretched on. Then came the sound of someone shifting, and a voice slipped through the gap around the door, much younger than she'd imagined. Hoarse and thin in the way a person sounded after sitting in the same position for hours without anything to drink. "No," the voice answered. "All right," she said. She allowed the silence to remain between them a little longer. "How old are you?" she asked. This time, he answered more quickly. 22, he said. Lainey looked down at the concrete floor beneath her feet. 7 hours inside a passage less than 3 feet wide, surrounded by hot pipes, alone with what he'd done at 7 o'clock that morning, and what awaited him on the other side of the door. She'd been inside confined spaces before. She knew what 7 hours could do inside a person's mind, when there was nowhere to put the thing trapped within him. He wasn't hiding. He simply didn't know how to step outside. "Casey," she said. It was the first time she'd called him by name. "I'm going to tell you the truth about what's waiting outside this door. There are federal agents at both ends of the corridor, and they aren't going anywhere. You already know that." She paused. "But there's a very great difference between walking out on your own now and allowing this to end another way," she said. "That difference is real, and it's the only thing you still have in your hands." There was a sound of fabric brushing against the wall. "They told me that man had done terrible things," he said. "They told me I was on the right side." Lainey didn't argue. She didn't tell him he was wrong. She didn't tell him he'd been deceived. "The people who used you and then abandoned you inside a corridor," she said, "aren't on the right side of anything." This was the longest silence of the entire conversation. "It'll take you many years to understand that," she said, "but you can't begin to understand it while you're still in there." There was the sound of someone bracing a hand against the wall, and slowly, carefully rising to his feet in a space where no one could stand quickly. Then came the sound of the door wedge being pulled away. The door opened inward. Casey Bidwell stood in the doorway with both hands already raised before anyone could order him to lift them. He held out the weapon himself with 2 fingers, keeping it extended away from his body, until an agent stepped forward and took it from his hand. He didn't look at the agent. He didn't look at Barrow. He turned his head toward Lainey and held her gaze, while the other 2 agents drew his arms behind his back. Lainey looked back at him. She didn't smile. She didn't say a word. She gave him one short, restrained nod. Not forgiveness, only an acknowledgement that he'd walked out on his own 2 feet. At 4 o'clock in the afternoon, Barrow handed Lainey a cup of water in the 2nd-floor hallway and told her what he'd been holding inside since 2 o'clock that morning. "I knew your father's name because the workshop in Highlandtown has been in our files since 2021, he said. "Not because of him. We were monitoring a lending operation active within a 6-block radius of that location, and the workshop's address was on a list of small businesses the group had approached. We opened a file, we recorded the names, and we did nothing because the office had other priorities that year. Lainey held the cup of water but didn't drink. "Thank you for telling me," she said. Then she entered the last room in the east wing to check the afternoon vital signs. Gideon was sitting upright. On the blanket before him lay a stack of printed pages that hadn't been there before. "Barrow had these copied from the files I gave them 6 days ago," he said. "I asked him to print several pages." Lainey checked his blood pressure first. 106/68. She recorded it on the separate sheet of paper. Then he turned the stack around and pushed it toward her. "In February of 2022, I shut down every lending operation in Highlandtown," he said. "Not for moral reasons, because it was cheap, and it created enemies in exactly the places where I didn't need them. I had every ledger collected, every debt crossed out, and people sent to each house to tell them no one would come to collect again." He tapped one finger against the stack of pages. "This is a copy of the settlement ledger," he said. "Page 4. Lainey turned to page 4. It was a photograph of a handwritten ledger, ruled into lines, with abbreviated names, figures, and a column on the right recording each account's status. She read from the top down. The 11th line contained 3 entries. Pruitt, E. The column on the right read paid in full. Beside it was a date. She stared at that date for a long time. Her father had died on July 23, 2022. The date on the page was February 11th of that same year. 5 months and 12 days. She turned to page 5, then page 6. Every line in the right-hand column carried the same words. 3 years, she said aloud, though she hadn't intended to speak. He didn't ask anything. "I kept paying for 3 years, she said. "Someone came every month. It wasn't always the same person, but someone came every month." He remained silent. He'd known she would say those words from the moment he pushed the pages toward her. "The lending operation in Highlandtown didn't close," he said. "It simply stopped belonging to the organization. Someone kept it for himself and continued sending people to collect, while the people named in this ledger had no way of knowing whom they were paying." He let the next words remain unspoken for a moment. "The only person who held that ledger before the debts were crossed out," he said, "was the man sitting beside me when I gave the order to erase them." Lainey stood at the foot of the bed, holding the stack of pages in both hands. She thought about the shift schedule taped inside her locker. She thought about 36 envelopes. 36 times she'd stepped into the common hallway and closed the door behind her. Then she thought about the night of July 23rd. That evening, her father had walked to the end of the street to meet the lender and ask for one payment to be postponed. He'd returned to the workshop shortly before 11 o'clock at night to lock the door. They found him the following morning, the ring of keys still clutched in his hand. He had gone to ask for more time on a debt that had been erased 5 months earlier. She set the stack of pages on the edge of the bed because her hands could no longer keep it from trembling. How could he?" she said. The final sound broke apart in her mouth. She tried again. The second sentence couldn't make it past her throat. She didn't try a third time. She stood there with both hands gripping the bed rail, her knuckles white, her head lowered, and she wept without making a sound. Her shoulders trembled. She didn't raise a hand to her face. She let the tears fall onto the backs of her hands and didn't wipe them away. Gideon said nothing. He didn't say he was sorry. He didn't say he would make amends. He didn't reach for her. He sat there with the incision across his abdomen and the drainage tube at his side, looking straight ahead instead of at her, giving her the only thing one person could offer another in a moment like that, the kindness of not being seen. He remained that way for 3 minutes. When Lainey straightened and wiped her face with the cuff of her sleeve, he waited one more beat before turning his head toward her. "His name is Ambrose Teague," he said. "You'll meet him." At 10 o'clock the following morning, Barrow stood at the end of the second-floor hallway, and Pemberton asked him the same question everyone on the floor had been asking since morning. "He knows we're waiting for him," Barrow said. "He's coming anyway." "Why?" Pemberton asked. "Because for over 20 years, he's never asked that boy a question without receiving an answer," Barrow said. "This is the first one. He can't bear to hear the answer through an indictment." Ambrose Teague arrived alone. He drove himself and parked in the visitor lot instead of the employee lot. He brought no one with him. He signed his real name at the reception desk, said he was there to visit a patient on the second floor, and waited for 7 minutes in the seating area until someone came down to escort him upstairs. Barrow positioned people at both ends of the second-floor hallway, removed everything that resembled a security checkpoint, and allowed Teague to enter the last room in the east wing, while 2 recording devices were running, and no one except 3 people was inside. Lainey was there because Teague arrived precisely when she was scheduled to change Gideon's dressing, and because Barrow had told her that if she left, The room would look different and Teague would notice. Teague entered and looked at the man in the bed. He didn't rush toward him, embrace him, or cry out. He stopped in the middle of the room, studied the drainage tube, the IV line, and the color of Gideon's skin, then nodded once like a man who had completed an inventory. "You've lost weight," he said. "Sit down," Gideon said. Teague sat in the chair in the corner and placed his leather briefcase beside his foot. He said he'd heard about what had happened 2 nights earlier, and that he'd also heard about the medication bag, and he spoke about both in the voice of a man reading a report. Then he came to the real reason for his visit. "You intend to sit down with them," he said. "Yes," Gideon said. Teague nodded slowly. He sat with his back straight and both hands resting on his thighs, then continued in the same voice Laney imagined he'd used to teach Gideon for 22 years. "Your father died when you were 12, he said, "and the organization should have collapsed within 6 months. It didn't. It didn't because one man sat in a kitchen on the South Side for 3 years, arranging, calculating, deciding who would be left alone and who wouldn't, making one move at a time until everything stood firm again. The man sitting in that kitchen was me. The person pushed to the front, the one whose name was spoken, was you." He didn't say it bitterly. He said it as though he were reading a line from a ledger. "For 30 years, I was the one who thought, while other people were the ones whose names were spoken," he said. "I never asked to change places. I chose that position because it was the position that kept everything standing still. I raised you from a 12-year-old boy sitting on a doorstep. I taught you everything one piece at a time, and I watched you do better than even I had calculated." He paused. "And now you intend to carry all of it into a room with recording devices," he said, "and hand it to people who will use it to erase those 30 years from the face of the earth. I can't understand it. It's the only thing in my life I've never been able to understand." Gideon allowed him to finish. He didn't interrupt once. When Teague stopped, Gideon looked at him. 9 people died, he said. "You knew." "I knew," Teague said. "When did you create that network?" Gideon asked. Teague didn't answer. "You don't understand the cost of keeping everything standing still," he said. "I do understand," Gideon said. Then he spoke the final words he would ever say to that man in that room. "You aren't angry because I betrayed the organization," he said. "You're angry because I betrayed you." Teague didn't answer. He sat motionless for 3 seconds, then bent down, picked up his briefcase, and rose. The door opened when he was still 2 steps away. Barrow stood in the hallway with Wolcott and 4 agents. Teague didn't resist. He allowed them to read him his rights, and the charges of conspiracy to commit murder for hire and obstruction of a federal witness, then placed both hands behind his back before anyone could touch him. As they escorted him down the hallway, he stopped for exactly 1 beat beside Laney. His eyes traveled from her white shoes to the name badge on her chest. "You're a nurse," he said. "Yes," Laney said. "I'm a nurse." 4 weeks later, a federal grand jury in Baltimore indicted 21 defendants. Ambrose Teague was charged among those facing the most serious offenses. The Sarkeesian family was indicted separately, in connection with the lending operation. Roland Fitch pleaded guilty to 2 counts and cooperated fully. Casey Bidwell pleaded guilty, cooperated, and identified the entire chain of people who had approached him. Before Casey's sentencing hearing, the court received a handwritten letter 2 pages long, written in small, even script, and signed Delaney Pruitt. Gideon Rourke pleaded guilty on an October morning to 1 count of conspiracy to engage in organized racketeering and 1 count connected to the protection racket, and his plea agreement included a provision requiring his full cooperation in every resulting case. His sentence was 40 months. No one in the courtroom called it a happy ending. He had done the things he admitted doing, and he paid the price for them. At sentencing, the judge made it clear that a person's decision to tell the truth didn't erase the years during which that person had chosen to remain silent. Gideon stood and listened to everything without reacting, then was escorted out through a side door. 3 weeks later, Calvert Hill held a hospital-wide meeting in the auditorium on the ground floor, with every department represented, and the chief executive officer read the findings of the internal review before the entire staff, instead of distributing them through internal mail. She read each failure aloud and softened none of them. The process for issuing access cards to temporary personnel hadn't been strict enough. Verifying medication lot numbers had been treated as a formality. The 4th-floor camera system had no mechanism for issuing an alert when a feed stopped recording. There was no channel through which a nurse could report an irregularity above the treating physician when that physician didn't answer the phone. She finished reading all 4 findings, then raised her eyes from the page. "The reason we're still able to sit here today," she said, "is that a night shift nurse opened a camera feed that wasn't part of her assigned duties, just weeks after her own department head wrote to the committee that she wasn't suited for complex cases. She paused. "I want all of us to sit with that sentence for a moment," she said. The auditorium fell silent. Lainey sat near the back, where she'd always sat during every meeting. In the second row, Dr. Corinne Ashford sat with her back straight and didn't turn around. 3 days later, she used the department calendar to register for a bedside emergency response class taught by Delaney Pruitt, and she registered as a student rather than a supervisory observer. Lainey approved her application. During that same week, a flat box addressed to her was delivered to the reception desk. It had passed through security screening and came with nothing except a small note. Inside the box was a tarnished brass sign with warped edges and 4 screw holes, one in each corner. Raised lettering across it formed 2 lines: Pruitt & Sons, Machine Works, Highlandtown. She hadn't seen it since the summer her father died, when the debt collectors had taken everything from the workshop that could be carried away. The note contained only one handwritten sentence: "It never belonged to them." At the end of that year, the Calvert Hill Intensive Care Unit added a new item to its official procedures. During every night shift, the nurse in charge would open every camera feed on the floor once each hour and record the results in the log. It was named the Routine Visual Inspection Procedure. No one's name was attached to it. 40 months is enough time for a life to travel a considerable distance. Lainey finished paying Wyatt's co-payments in the spring of the second year, and for the first time in 4 years, she opened her banking app without having to subtract an expense before looking at the balance. In September of that second year, Wyatt received a kidney transplant. The boy remained in the hospital for 19 days. On the 4th night after surgery, he woke up, and the first thing he did was ask for a sandwich. Lainey sat in the chair beside his bed and laughed until she had to cover her face with her hand. In the summer of the 3rd year, she rented the same space in Highlandtown that had once housed her father's workshop. She repainted the walls, set up an examination table, and fastened the old brass sign to the wall behind the reception desk, using the same 4 screw holes. Every Saturday evening, she held a free nursing clinic and consultation session, open to people of all ages with no appointment required, checking blood pressure and blood sugar, changing dressings, and teaching elderly residents in the neighborhood how to take their medication. She still worked 3 night shifts a week at Calvert Hill. On the day Gideon Rourke was released from prison, no one was waiting at the gate. There was no black car, no flowers, and no one wearing a suit. He carried a canvas bag, walked to the bus stop, and boarded a bus. On the following Saturday evening, a man in an ordinary coat stopped on a sidewalk in Highlandtown and looked through the wide window of a small clinic. Inside, a woman was kneeling on one knee in front of a chair, rewrapping a bandage around the lower leg of an elderly woman with silver hair and saying something that made her laugh. In the corner, a boy about 11 years old was arranging a row of plastic chairs. The woman looked up. She looked through the window. Then she rose, crossed the room, and opened the door. Some people go through their entire lives without ever truly being seen. They work night shifts, clean hallways, record numbers no one reads, and people pass them every day without understanding whom they've just walked past. The label someone else places on you isn't a measure of who you are. This story doesn't say that everyone is hiding an extraordinary past. It says something simpler, that a person's dignity doesn't lie in the title printed on the badge pinned to their chest, and that the people who keep an entire system from collapsing are often the ones working during the hours no one notices. The most memorable thing about Delaney Pruitt wasn't the 9 seconds inside that room. It was that after those 9 seconds, she still returned to pull the blanket up to her patient's chest, and she still stood outside a steel door to ask a young man whether he was hurt. True strength isn't the ability to hurt another person. It's choosing to remain kind at the very moment when you hold the advantage, and no one is forcing you to do so. Quiet kindness, doing what is right every day even when no one recognizes it, is what truly holds this life together. If the story you've just heard touched your heart, please leave a like, share it with someone you believe also needs to hear it, and subscribe to our channel for more meaningful stories every day. How do you feel about Delaney? And is there someone in your life who is being seen as less than who they truly are? Please leave a comment. We sincerely want to hear the feelings that come from deep within your heart. We wish everyone watching this video lasting good health, a joyful life, and peace every day. Goodbye, and we'll see you again in the next video.